Good morning, everyone. I'm Jocelyn Tolentino, one of those who will report on Chapter 8. Our topic, the impact of information technology on productivity and quality of life. The impact of IT on the standard of living and workers' productivity. IT has improved productivity and the standard of living by increasing innovations. The standard of living varies greatly among groups within a country as well as from nation to nations. The most widely used measurement of the material standard of living is gross domestic product per capita. National GDP represents the total annual output of a nation's economy. Overall, industrialized nations tend to have a higher standard of living than developing countries. In the United States, as in the most developed countries, the standard of living has been improving over time. However, its rates of change varies as a result of business cycle that affects prices, wages, employment levels, and the production of goods and services. Major disasters such as earthquakes, hurricanes, tsunamis, and war can negatively impact the standard of living. The worst economic downturn in U.S. history occurred during the Great Depression when the GDP declined by about 50% from 1929 to 1932. By 1932, the unemployment rate had reached 25%, by A16 by way of comparison. During the latest recessions in the United States, which began in 2007, the GDP growth rate declined by 6.8% during the fourth quarter of 2008. The GDP growth rate declined by 6.8% during the fourth quarter of 2008, and the U.S. unemployment rate hit a peak of 10.2% in October 2009. Next is IT investment and productivity. Productivity is defined as the amount of output produced per unit of input, and it is measured in many different ways. For example, productivity in a factory might be measured by the number of labor hours it takes to produce one item, while productivity in a service sector company might be measured by the annual revenue an employee generates divided by the employee annual salary. This gain in productivity have led to increase in the GDP-based standard of living because the average hour of labor produce more goods and services. The Bureau of Labor Statistics track U.S. productivity on a quarterly basis in the United States. Labor productivity growth has averaged about 2% per year for the past century. In the early days of IT in the 1960s, productivity improvement were easy to measure. For example, mid-sized companies often had a dozen or more accountants focused solely on payroll-related accounting. When businesses implemented automated payroll systems, fewer accounting employees were needed. The productivity gains from such IT investment were obvious. Innovation is a key factor in productivity improvement. Pinapataas ng teknolohiya ang produktibidad, iyon ay ang dami ng output sa bawat unit. Ang pagtaas ng produktibidad ay nangangahulugan ng higit pa sa mga kalakal at serbisyo na nagpapataas ng pamantayan ng pamumuhay ng tao. The following list summarizes additional factors that can affect national productivity rates. First is labor productivity growth rates differ according to where a country is in the business cycle, expansion or contraction. Times of expansion enable firms to gain full advantage of economies of scale and full production. Times of contraction present fewer investment opportunities. Second is outsourcing can skew productivity if the contractor firms have different productivity rates than the outsourcing firms. Next is regulations make it easier for companies in the United States to hire and fire workers and to start and businesses activities compared with many other industrialized nations. This flexibility make it easier for market for goods and workers to more productive firms and sectors. Next is more competitive market for goods and services can provide greater incentive for technological innovations and adaptations as firms strive to keep ahead of competitions. In today's service-based economy, it is difficult to measure the real output of such services is accounting, customer service, and consulting. IT investment don't always yield tangible result, such as a cost savings and reduced headcount. Instead, many produce intangible benefits such as improved quality, reliability, and services. As you can see, it is difficult to quantify how much the use of IT has contributed to worker productivity. Ultimately, however, the issue is academic. There is no way to compare organizations that don't use IT with those that do because there is no such thing as a non-computerized airline, financial institutions, manufacturer, or retailer. Business people analyze that expected return on investment to those which IT options to implement, but at this point, trying to measure its precise impact on worker productivity is trying to measure the impact of telephones or electric.
The impact of information technology on productivity and quality of life. Gross domestic product or GDP, measurement of the material standard of living, equals total unknown output of a nation's economy. Standard of living in US and developed countries has improved for a long time. Rate of change varies as a result of business cycles. Productivity, amount of output produced per unit of input measured in many different ways. United States labor productivity growth 2% annually. Living standard have doubled about every 36 years. Modern management techniques and automized technology increase productivity. Innovation. Key factor in productivity improvement, IT has an important role. Relationship between IT investment and productivity growth is complex. Rate of productivity from 1995 to 2005 is only slightly higher than the long-term US rate. Possible lag time between application of innovative IT solutions. Capture of significant productivity gains. Other factor besides IT influence worker productivity rails. Default to equality, how much the use of IT has contributed to work productivity. Telework or telecommunicating, employee works away from the office, advances in technology enable communication. Higher skilled worker demand more flexibility. Laws passed to encourage telework. Organization must prepare guidelines and policies. Some positions are not to telework. Some individuals are not to be a telework. Standard of living, level of material comfort, measured by the goods, service, and luxuries available. Digital divide, gulf between those who do or don't have access to cell phones, personal computers, and internet. Gulf among age groups, economic classes, and cities, rural areas. Resolution of health emergencies, crime emergencies, or other emergencies. Access to IT and communication technology enhances learning, provides educational and economic opportunities, influence cultural and social and political considerations. Education rate or E-rate programs created by the Telecommunication Act of 1996. Goal is to help schools access to state-of-the-art services and technology discounted rates, 25 billion per year from charge to telephone customers. administrated by the Universal Service and administrative of Company of USAC, has not gone well but continues today. Lack of IT on healthcare cost. Rapidly rising cost of healthcare is major challenge. Spending increasing at 6.3% per year, growing from 6.6 trillion to 4.6 trillion by 2019. Increase above inflation due to the new medical technology. Diagnostic, produce, and treatments. Patients sometimes accuse medical resources. Patient awareness must be raised, technology costs must be managed. Improved use of IT can lead to cost reductions.
The digital divide. When discussing standard of living, it encompasses material comforts like goods, services, and luxuries beyond just GDP. Factors included calorie consumption, clean water access, life expectancy, literacy rate, freedoms, doctor ratio, infant mortality, crime rate, home ownership, and educational opportunities. These indicators measures of overall quality of life. The availability of information and communication technology is another indicator of standard of living. In the digital divide, referring the gap between those who have access to modern technology like cell phones and the internet, and those who do not. Worldwide, around the world, 2.4 billion people use the internet, but the other distributions of users vary greatly by region within countries. For example, in India, urban residents are more connected than those in rural areas. In the United States, minorities, low-income adults, and senior citizens are less likely to have internet access. Many believe bridging the digital divide is crucial as it can speed up responses to health, crime, and other emergencies through easy access to communication network. IT and communication technology can improve learning, create economic opportunities, and impact cultural, social, and political aspects by providing vital information for career, retirement, health, and safety management. The E-Rate program discussed in the opening vignette was designed to help eliminate the digital divide within the United States. This program and others designed to increase availability, low-cost computers, cell phones, and smartphones are discussed in the following sections. E-Rate Program. The E-Rate program was established in 1996 to help schools and libraries access broadband internet services. The program provides discounts ranging from 20% to 90% on eligible services based on location and economic need. Schools and libraries must apply for these discounts, and the USAC ensures that service providers pass them along to participants despite criticism of fraud and lack of evidence showing improved students' performance. The program continues to provide $2.3 billion annually. A University of Chicago study in California found that while more students in poor schools were going online, there was no significant impact on test scores. Researchers suggested that schools may not know how to effectively use the internet, or that internet use may not be a productive way to improve academic performance. Despite its shortcomings, the e-program remains the vital source of advancing access to educational sources. Low-cost computers. In June 2012, about 2.4 billion people had internet access, leaving 5 billion unconnected. Mostly due low income, providing low-cost computers can help reduce the digital divide and increase internet access worldwide. One laptop per child, OLPC. The non-profit organization One Laptop per Child, or OLPC, aims to provide low-cost laptop computers to children worldwide for educational purposes. The program has distributed over 2.4 million computers in the 14th century. With the current model being the X04, this laptop is energy efficient, costing $206, and comes with a suite of additional applications called Sugar. In Nepal, where poverty is limited, access to social services are prevalent, The OLPC program started in 2008 as a pilot project in 2 schools and has since expanded to 32 schools, and an initiative aims to enhance education equality and access to instructional materials by training teachers by integrating technologies into their teaching practices. In contrast, in 2006, Intel introduced the Classmate PC, a low-cost laptop designed for educational use in the developing countries. Over 4 million Classmate computers has been deployed globally with various models available, running either Windows 7 or Linux operating system. And equipped with educational software, Intel partners with manufacturers to produce the laptops, which are targeted by bulk purchases by educational institutions in the third world countries. Both the All-PC and Classmate programs highlight the importance of technology in education and their efforts to bridge the digital divide in the unreversed communities around the world. Raspberry Pi. The Raspberry Pi is a small and expensive computer developed by a UK charity. It comes with a 256 to 512 MB of RAM and a 700 MHz processor. USB and Ethernet ports running on Linux, designed to teach programming to children and serve a low-cost desktop replacement. While its price is appealing, its ruggedness, portability, and functionality for educational use remain uncertain. The quantity to be manufactured is also unknown. Mobile phone, the tool to bridge the digital divide. Increasing use of mobile phones is seen as a crucial step in bridging the digital divide in many countries. With more people having access to cell phones than computers, the infrastructure of wireless communications has been expanded rapidly. Financial institutions and organizations have developed applications for cell phones to process transactions and store cash or credits. Cell phones have various advantages over personal computers, including affordability, portability, extended battery life, ease of use, and minimal technical support requirements. As technology becomes more affordable, more people are able to upgrade smartphones with the access to the Internet of virus applications. This access to information and communication can lead to economic, educational, and personal development. Bridging the digital divide could enhance the sharing of ideas, culture, and knowledge globally, potentially raising the standard of living in undeveloped countries and reducing issues like violence, poverty, poor health, and terrorism. The end of the digital divide may also lead to a shift in how people perceive themselves in relation to the rest of the world, bringing about a positive social changes. The impact of IT on healthcare costs. The rising cost of healthcare in the United States is a major challenge, with the spending reaching $2.7 trillion in 2011, expected to increase by 6.3% annually through 2021. Factors driving this growth include the aging population, increased healthcare expenditures per person, and the development and use of new medical technology. While new diagnosis produced and treatments are often more effective, they also come with higher costs, leading to greater overall healthcare spending. Patients may overuse medical resources that appear to be low cost to third-party payment systems like insurance. Efforts to control costs, such as insurance company regulations, have been largely ineffective to address rising healthcare costs. Patient awareness must be raised, and technology costs must be managed more efficiently. Increased use of IT in the healthcare industry can help reduce costs in various ways. Electronic health records. The healthcare industry has increased its investment in IT, spending over $88 billion in 2010 to implement electronic health records (EHRs) and other technologies. Using IT to capture and record patient data can improve healthcare and productivity by providing a consolidated view of a patient's health history. Currently, patients often fill out the same forms repeatedly, and medical personnel struggle to locate the paper records, leading to errors and increased costs. An EHR is a computer-readable records of health information that includes patient demographics, medical histories, medications, and more. Having a comprehensive health information network can prevent many preventable medical mistakes and save lives. Transitioning to digital records has the potential to greatly improve patient care and safety in the healthcare industry. With an EHR, healthcare professionals can be easily access and share patient information, leading to better outcomes and reduced errors. Implementing electronic health records is a crucial step forward improving effectiveness of healthcare system globally. The Health Information Technology for Economic and Clinical Health Act, HITECH Act, was passed in 2009 as part of American Recovery of Reinvestment Act Economic Stimulus Plan. It aims to increase the use of health information technology by developing standards for electronic exchange of health information, providing incentive for doctors and hospitals for use electronic health records (EHR), improving care quality and strengthening health information protection. Hospital and physicians can receive significant incentives for implementing EHR systems and demonstrating meaningful use with penalties for non-compliance. However, the adoption of EHR system has been slower than expected. The skeptics question their cost-effectiveness and impact on healthcare quality. Critics point out challenges in sharing patient information across different systems and concerns about increased healthcare costs. Despite predictions of cost savings and quality improvements, evidence supporting these claims remains limited. Some experts question the value of EHR systems, citing high implementation costs and a lack of conclusive evidence on improving patient care quality. The RAND Corporation's studies have shown mixed results in the impact of EHR system on healthcare processes. The implementation of EHR system poses financial challenges for both large medical institutions and small practices, with significant costs involved in purchasing, deploying, and maintaining those systems. Some healthcare providers have reported substantial expenses related to EHR implementation, impacting their operating costs and patients' care. Looking ahead, questions remain about future of healthcare spending, the effectiveness of EHR system in reducing avoidable deaths, and the ethical implications of advocating their adoption. The debate continues whether the investments of EHR system will ultimately lead to positive outcomes in terms of cost savings and improved healthcare quality. Overall, the HITECH Act triggered a significant shift towards electronic health records in the healthcare industry. However, the full impact of effectiveness of EHR system are still being debated, with ongoing discussion on their costs, benefits, and potential drawbacks. As the healthcare landscape continues to evolve, stakeholders will need to carefully evaluate the outcomes of application of implementing EHR systems to ensure they align their goals of improving patient care and reducing healthcare costs.
Use of mobile and wireless technology into healthcare telehealth. Telehealth, the integration of mobile and wireless technologies in healthcare has significantly expanded the scope of medical services. It allows for voice-enabled and touch-screen communication from smartphones and tablets, providing the health-related applications and the enhanced internet connection. These devices enable monitoring of medication compliance, telemedicine, vital signs, and access the patient's medical files, especially in a low population or difficult to reach areas. Mobile and wireless technology in healthcare and telehealth offers numerous benefits. It improves accessibility, convenience, and efficiency by enabling to remote access to receive to services, reducing the needs for in-person visits. It also facilitates real-time communication between healthcare professionals and patients, enabling quicker diagnosis and better coordination of care. Telehealth services delivered through mobile devices can reduce healthcare costs by minimizing hospitalization and emergency room visits. Mobile technology has enabled remote monitoring of patient health metrics and promoting early detection and proactive management. It empowers patients by providing access to health information and resources, fostering responsibility for their health. Its scalability and flexibility make it ideal for public health emergencies. It also enables data integration and analytics, providing insights into patient trends and personalized medicine approaches.
Medical information website for laypeople. Medical information website for laypeople are online platforms designed to provide health-related information in format that is accessible and understandable to the general public. These websites are typically aimed to educate users about various health conditions, symptoms, treatments, and preventive measures. Importance. Medical information websites are enable resources for laypeople for several reasons. Firstly, they provide easily understandable explanation for medical conditions, symptoms, and treatments, helping users to apprehend complex medical jargon in simpler terms. This accessibility bridges the gap between professional medical knowledge and the general public, fostering and better understandable for health issues. Additionally, these websites offer up-to-date information, ensuring that users have access to latest medical research and treatment options. This empowers individuals to make informed decisions about their health and seek appropriate medical care when necessary. Furthermore, medical information websites often include preventive health advice, which help users adopt healthier lifestyle and potentially reduce the risk of developing certain conditions. Overall, these websites play a crucial role in enhancing health literacy and promoting public health. For example, an individual who needs a hip replacement can go online and find information about the surgery, other available treatment options, a list of questions to ask the physician, potential risks, nearby hospitals that perform the surgery, and quality of service information about the hospital, such as the number of reported postoperative infection and other complications.